Hello, my name is Dr. Ibi. I welcome you once again to this channel, Beyond the Consulting Room. In this video, I want to address an issue whereby you can have one disease or one infection, but there are several treatment options suggested for this one disease or one infection. Now, is it the case that in actual fact, we have different kinds of diseases and we are using one name to represent them? So let's say the herbal medicine seller has a version of typhoid infection or hepatitis B infection. So when it says hepatitis B infection or typhoid infection, he or she doesn't actually mean typhoid infection as pertains to orthodox practice. Or when the homeopathic practitioner is talking about diabetes or hypertension or stroke, he or she actually means something different from the version of hypertension, diabetes as known in orthodox practice. So probably we are using the same name to represent different diseases or infections. And that is why different treatments are being suggested for these diseases. Okay. If it is actually the case that we are actually talking about one name and one disease, if typhoid infection means typhoid infection in orthodox practice, homeopathy, herbal medicine, all right, diabetes, hypertension means the same in all kinds of healthcare systems, that it is possible that some of the treatments that are being given for these diseases or infections are only treating the names of these diseases or infections, but are not treating these diseases or these infections. Okay? Now, if you fall ill, the thinking is that there is an explanation for the illness. So there's knowledge to explain why you fall ill. We don't like to think that you are the originator of that illness. Okay? The symptoms that you experience, the signs that we pick up in a facility, in a health facility, you are not the originator of that illness. All right? The goal is to give you treatment that will take away the illness. Okay? But first, we must make a diagnosis. We must explain the illness. Now, when we explain the illness into a disease or an infection, then we can find an antidote to that illness or disease. In other words, every disease goes with a specific diagnosis. So every symptom that you experience, every illness that you experience in your body has an underlying explanation as a disease or infection. And then every disease or infection goes with a specific treatment, okay, that is directed towards the cause of that disease or the mechanism of that disease or infection, okay. And the good news also is that we try to treat you with the current best method, all right. So we weigh all the options that are available in managing such a condition, and then through research, okay, we're able to tell that of all the many options, this is the one best method that we can give you, okay, we can use to treat you, right? So all the time we go for the current best method, and that is what we call evidence-based practice. So evidence-based practice is basically to make sure that every treatment you are given or every intervention that you receive, there's evidence that it is the current best practice, okay, and it is best in terms of efficacy or effectiveness. It is best in terms of safety. It is best in terms of efficiency, and so on and so forth. And when we say it is best, it means that we have compared this treatment with many other treatments. Okay, that is why we say that it is best. And when we say it is current, it means that it is the most updated. All right, efforts are being made to come up with newer and better treatments. Okay, but until then, until when we find alternatives better and newer than what is currently being done for you, this is the current best, and we are going to be updated, okay, when something new comes up. So this is very assuring, and that when you come to the health facility, when you fall ill, there is the need, okay, to use the current best method to manage you. Okay. Now, when we talk about evidence-based practice, it's not something that we use only in medicine. Okay. Evidence-based practice is used in many fields. For instance, we have what we call evidence-based management, where the best practices in management have been found, researched, and documented, and they are taught in school, okay, for people to learn and use them in managing institutions and managing people. So we don't do trial and error, okay? We have evidence-based education, EBE, where people have used research to discover best practices, okay, in terms of education, in terms of teaching and learning, so that can get very good results. So evidence-based practices are meant to oppose tradition. Tradition says that this is how we always do it. This is what our forefathers used to do. Okay, they are meant to oppose personal opinions. All right, where people think that the way I think is what should be done. Okay, they are meant to address the issue of personal experiences. All right, whereby people rely so much on their personal experiences to solve problems. Okay, even expert opinions are not to be considered as expert opinions unless they are based on evidence-based practice. Okay, so this is very reassuring that practices that we engage in a health facility, for instance, to take care of you are current best methods. Okay, now what it means is that if you have several treatment options being suggested for the same disease or the same infection, okay, the chances are that all these methods cannot be considered as current best methods. That is what it means, okay? And it is possible that these methods may be managing just the names of the diseases, but not treating disease itself. And that is possible even in orthodox practice, okay? We have found situations whereby, let's say a person is coughing and is breathless, and the person has come to the health facility, and then because the person is in an emergency situation, especially in low resource settings, we are not very certain, okay, as to the exact cause of the person's illness. All right. So we work with what we call provisional diagnosis, and then we start emergency treatments. So the person is coughing, is breathless. You might think the person has an asthma and start treatment for an asthma. You might think the person has a heart failure with fluid in the lungs and start treating to clear fluid from the lungs. You might think the person has an infection like a pneumonia and give antibiotics to address this infection. All right. But after doing further tests, doing chest X-ray, doing investigations on the heart, doing some sputum investigations, lab investigations, we are going to realize, okay, that in actual fact, there was no asthma. So we have to discontinue the plan to treat for asthma. There was no infection. It was no pneumonia. We have to stop antibiotics and not continue the antibiotics. Then we are thinking that it was actually the heart. Okay, so we continue managing for a heart failure. But the point I'm making is that the asthma medication was given, or treatment was given, it did not find asthma to treat. It only treated the name asthma. Okay, get cleared from the system, nothing happened to the person. All right, it's the same way the antibiotic that was given was not treating any infection. There was no pneumonia. It just got cleared from the system. All right, so the name pneumonia was treated, but there was no germ or disease pneumonia to be treated. This is what can happen in orthodox practice sometimes if we are trying to make diagnosis, okay? In the process of making diagnosis, accurate diagnosis, all right? So if you have different treatments being directed towards a single disease or a single illness, chances are that only one of them treated a disease or infection. So if you have several treatments being suggested for the same infection, the same disease, all right, chances are that some of these treatments are only treating names of diseases and they are not treating disease itself. Okay, thank you very much for watching this video. Subscribe to my channel. Thank you.
Presenting 4 life-changing books by Dr. Abraham Amponsah. Positive Health, Health Beyond Pills. Becoming the best version of humanity. What you need to know about medical checkup. The right treatment for the right disease. Visit www.drab.org for your soft copies. And for your hard copies, call or WhatsApp 0548 6969